Hospitals have changed how they look at their inventory as a result of COVID. It used to be hospitals kept low stockpiles of things and could order whatever they needed whenever they wanted. But that's not the case since the pandemic. Our Jay Bird joins us live at Baptist Hospital tonight to explain how hospitals are battling the supply chain issues. Jay.
Yeah, Kevin, the folks that are behind the scenes trying to acquire everything a hospital needs, they are constantly on the prowl, constantly shopping for those needs. But it's a little more complicated, a little more difficult than maybe, say, you and me looking for lightning deals on Amazon. When COVID cases go up, hospitalizations eventually follow, which means more work is being done in hospitals across the state.
So we are using more masks than ever. We're using more gloves than ever. We're using more isolation gowns than ever.
Lisa Farmer handles the supply chain for Baptist Health. She's in charge of procuring everything in a hospital, from PPE to implants to the gases used like oxygen. And they are not immune to supply chain issues.
I kind of look at my job as a roller coaster ride every day. I never know when the curves are coming, or when the dips or the high drops. It's everything.
She has deals in place with manufacturers, but there are times when supplies are still limited. She tries every avenue possible, but avoids things like Amazon.
And that's the last thing we want here, is to have counterfeit or gray market items, because again, patient focus. And we do not want to put any patient at risk.
When supplies do get lower, she meets with folks to see how they can stretch it if they can. Farmer also said there's been a focus to reuse certain items more, like bed linens.
I think that's going to be the focus for at least the next 2 to 3 years, probably, for supply chain. It's just going to be something as simple as sustainability.
She's constantly wheeling and dealing for supplies, even for things beyond COVID care. And anytime she can acquire a need, it's usually a short celebration before the next challenge presents itself.
So do I ever take a deep breath and think I can kind of relax? I haven't found that place yet. I'm waiting on it. I'm hoping that maybe this year I'll be able to.
Now, Farmer adds that many of the hospitals in the state do cooperate in the spirit of trying to just help Arkansans. She also does say that Baptist doesn't necessarily hoard the things that they acquire. They have donated masks to the Little Rock School District. They've also helped out some of the smaller and rural hospitals in the state of Arkansas when they cannot necessarily acquire some of the supplies that they need just because they are a little smaller. Live outside of Baptist Hospital here in Little Rock, Jay Bird, Fox 16 News.